Thank you, Mr. Speaker. Federal Health Minister Philpott has brought opioids to the national stage with a summit on the crisis. And yes, Mr. Speaker, she called it a summit. And our PC caucus has been blowing the whistle loudly on this ever since Alberta started seeing a shocking number of deaths, including in our vulnerable Indigenous communities. We applaud the Federal Health Minister for this initiative that saw health ministers from across Canada attend, including BC and Ontario, the two other hardest hit provinces. So to the Health Minister, what did you and your Associate Minister learn at this summit? Or did you even bother to attend?
No, but you're asking about
Mr. Speaker, and to the member for the question. I was very pleased to represent Alberta at the opioid conference and summit that was held earlier this month. One of the things that we learned at this summit is not just that the opioid dependency problem that we're seeing in this province is a complex, multifaceted one that requires a variety of responses, but that the movements that our government has been making are on the right track and supported by experts from across our country. Additionally, provinces across our country are looking to Alberta as a leader on this issue.
Speaking of leaders, the question was whether the Health Minister was in attendance. Now, given that the opioid crisis is a life and death issue for Albertans, and yet our province has yet to declare a public health emergency, and given that the summit applauded British Columbia for its network and framework for dealing with its opioid crisis, including declaring it a public health emergency, and given that on November the 21st, the Associate Minister told this House that there was more information and awareness about this crisis would be a wasted PR exercise. Again, to the Health Minister, when will you declare this a public health opioid emergency in this province?
Minister of Health.
Thank you, Mr. Speaker, and to the member for the question. I'm pleased to be our government's lead minister on this file, and I work diligently on this issue day and night. I can't speak to how other governments have associate ministers working, but in our government, I am considered an equal member of this team, and I've worked very hard on this issue. As for the question of data, our government is able, because we have a single health region, to compile most of the data that other jurisdictions require specific legislation to be invoked to gather. I'm very proud of the Q3 report that we've put forward that has a wide range of data, not just overdoses.
Thank you, Honourable Minister.
I shudder to think of how the families feel about the leadership. Given that many provinces, including British Columbia, have approved the nasal spray version of naloxone, which is much easier to administer, especially for those who are not first responders, and given that naloxone is saving thousands of lives and Narcan can save more, and given that we have not heard of its use in Alberta, to the Minister in charge, has Narcan been issued anywhere in Alberta? If so, to whom? And if not, why not?
Honourable Minister.
Thank you, Mr. Speaker, and to the member for the question. We do know that naloxone is able to save lives by reversing the effects of an overdose. However, medical attention is still required after administering naloxone. Our government has increased the access of naloxone across the province to have 13,000 kits available. We have also been working with our partners in justice to have the nasal spray available. The federal RCMP has made that move for their members, and that is something that we're continuing to explore. We know that getting naloxone in any form out to the community where people need it is going to help save.
Thank you, Honourable.